Hello dear students, and today's topic is chemotherapy. In today's session we will discuss about the general principles of chemotherapy or simply the introduction of chemotherapy. So what is chemotherapy? So the use of chemical substances for the treatment of infectious diseases or tumor is called chemotherapy. The use of drugs like a chemical entity or substrates or substances which are derived from microorganisms with the selective toxicity against the infections such as viruses, bacteria, protozoa, fungi and helminths is called as chemotherapy. The use of drugs in the treatment of neoplastic disease, that is tumor or cancer, is also known as chemotherapy because malignant or cancerous cells also have similarity with the pathogenic microorganisms. The drugs which are used in the chemotherapy to interfere with the functions of pathogens are called as chemotherapeutic agents. This includes drugs like antibiotics, antifungal agents, antiviral agents and so on. So what are antimicrobial agents? So antimicrobial agents are the natural, synthetic or semi-synthetic substances that kill or inhibit the growth of microorganisms like bacteria, viruses, fungi and parasites. When they kill the microorganisms, they are known as microbicidal activity, and when they inhibit the growth of microorganisms, then we call it as microbiostatic activity. So we can classify these drugs in various ways. Let us see the classification of antimicrobial agents. So antimicrobial agents can be classified in many ways, like we can classify them according to their chemical structures, according to its mechanism of action, type of organisms against which they are active. We can also classify them according to the spectrum of activity or range of activity, according to the type of action. That means either they kill or inhibit the growth of bacteria, and we can also classify them according to the source. So let us see how these antimicrobial agents can be classified in these ways. Let us see how can we classify the antimicrobial agents according to the chemical structure. So depending on the chemical nature of the drug, we can classify them into several types like sulfonamides and related drugs, which includes sulfadiazine and some other drugs like sulfones, dapsone. Second class is aminopyrimidines like trimethoprim, paramethazine. Third class is quinolones like nalidixic acid, norfloxacin, ciprofloxacin, etc. Beta-lactam antibiotics like penicillins and cephalosporins. Fifth class tetracyclines like oxytetracycline. Sixth class is nitrobenzene derivatives like chloramphenicol. Seventh class is aminoglycosides like streptomycin, gentamicin. Macrolide antibiotics like erythromycin, azithromycin. Next class is lincosamide antibiotics like lincomycin, clindamycin. 10th class according to chemical structure is glycopeptide antibiotics. Again we can also classify it as oxazolidinedione like linezolid. Next class is polypeptide antibiotics like polymyxin B, bacitracin. Nitrofuran derivatives, nitrofurantoin. Nitroimidazole derivatives like metronidazole, trinidazole. 15th class is there also nicotinic acid derivatives like isoniazid, pyrazinamide, Pauline antibiotics, amphotericin B. Azode derivatives like miconazole, ketoconazole, and some others includes drugs like rifampicin, cycloserine, and so on. So there are several classes of drugs we can classify according to the chemical structure. So this is the first possible classification of antimicrobial agents according to the chemical nature of that drug. Now we can also classify them according to the mechanism or mode of action of the antimicrobial agents, like those drugs which inhibit the cell wall synthesis. Examples: penicillins, cephalosporins, vancomycin, bacitracin, and so on. Second class, the drugs which cause leakage from the cell membranes, like polypeptides, polymyxins, bacitracin, amphotericin B are the drugs which cause leakage from the cell membrane. While tetracycline, chloramphenicol, erythromycin are those drugs which inhibit the protein synthesis, so it belongs to the class of drugs that inhibit the protein synthesis in the bacteria. Then fourth class is the drugs which cause misreading of mRNA code and affect the permeability, like streptomycin, gentamicin, that are aminoglycosides. Some drugs like fluoroquinolones inhibit DNA gyrase, while drugs like rifampicin, metronidazole interfere with the DNA function. There are certain drugs which interfere with the DNA synthesis like acyclovir, zidovudine. And there are certain drugs which can also interfere with the intermediary metabolism like sulfonamides, sulfones, and etc. So according to the mechanism of action, we can classify antimicrobial agents in this way. We can also classify these drugs according to the type of organisms against which they are primarily active, like antibacterial agents, antifungal agents, antiviral agents, antiprotozoal, and anthelmintics. Antibacterial are effective against bacteria. Example: penicillins, aminoglycosides, erythromycin. Antifungal agents are those agents which are used against fungal infections like grisefulvine, amphotericin B, ketoconazole are the examples of antifungal agents. While drugs like acyclovir, amantadine, zidovudine are effective against the viruses, so they are called antiviral agents. Antiprotozoal like chloroquine, pyrimethamine, metronidazole are effective against protozoal infections, while anthelmintics are those drugs which are used against the helminthiasis or helminths, worms. So anthelmintics includes mebendazole, parenteral, diethyl carbamazine, and so on. So we can classify antimicrobial agents according to the type of organisms against which they are active. We can also classify them according to the spectrum of activity, means the range of activity. There are two classes, narrow spectrum and broad spectrum. Narrow spectrum agents means those drugs or those agents which are effective against a very limited range of bacteria, such as primarily gram-positive or only specific gram-negative bacteria. They are highly targeted, causing less disruption to the normal flora and reducing the risk of superinfection. For example, examples of narrow spectrum includes drugs like penicillin G, which are effective against gram-positive bacteria. Sodium fusitate, it is effective against staphylococcal bacteria. So such drugs which are effective against few or very limited range of bacteria are called as narrow spectrum active agents. While broad spectrum agents, which are also called as wide spectrum agents, they act against wide variety of bacteria like gram positive as well as gram negative bacteria. So they are useful for empirical therapy or mixed infections, but increases the risk of resistance and superinfections. Examples includes drugs like chloramphenicol, tetracycline, and so on. So broad spectrum agents acts on wide variety of bacteria like gram positive as well as gram negative bacteria. Let us see what do you mean by hypersensitivity reactions. Practically all antimicrobial agents are capable of causing hypersensitivity reactions. Hypersensitivity reactions are unpredictable and unrelated to dose. The whole range of reactions from the simply skin rashes to anaphylactic shock can be produced by antimicrobial agents. The most commonly involved antimicrobial agents are drugs like penicillins, cephalosporins, sulfonamides, and fluoroquinolones. So these are among the drugs which produce hypersensitivity reactions. Drug resistance. It refers to unresponsiveness of a microorganism to antimicrobial agent and is akin to the phenomenon of tolerance seen in higher organisms. When a microorganism does not respond to antimicrobial agent, then that process is known as drug resistance. It may be natural resistance or maybe acquired resistance. So natural resistance means some microbes have always been resistant to certain antimicrobial agents. They lack the metabolic process or the target site which is affected by the particular drug. So they resist the effect of that drug. For example, gram-negative bacilli does not affected by penicillin G. So penicillin G does not produce any action, or they are not effective against gram-negative bacteria. This is example of natural resistance. Second type is acquired resistance, which is development of resistance by an organism due to the use of antimicrobial agent over a period of time. For example, gonococci quickly developed resistance to sulfonamides in 30 years. So resistance developed by a microorganism due to repeated use of that drug, due to repeated exposure to that drug. So the bacteria make some changes into their structure or functions and resist the effect of that drug. So such type of resistance is known as acquired resistance. Superinfection or suprainfection. The infection occurring after or on the top of an earlier infection, especially following treatment with broad spectrum antibiotics. This refers to the appearance of new infection as a result of antimicrobial therapy. It generally arises when antimicrobial therapy destroys the beneficial protective microbes in our body along with the pathogens, allowing a new, often drug-resistant organism to overgrow and cause a new separate infection. Superinfections are more common when the defense is compromised, particularly when the patient is on corticosteroid therapy or leukemias and other malignancies, especially when treated with the anti-cancer drugs, acquired immunodeficiency syndrome, and agranulocytosis. These are the reasons of superinfections. So while using antimicrobial agents, we should consider these three things. First, hypersensitivity reactions, we should think about it. Second aspect is drug resistance and superinfection. So this is all about the introduction of chemotherapy. Thank you.